We'll be talking about nut midline carcinoma. To understand nut midline carcinoma, we will derive the information from the term nut. So here's a picture. The picture shows a baby holding the nut. The baby represents the age group, that is, it affects children and young adults. The nut here represents the NUT-M1 gene. Also, there are 4 birds here who are competing for the nut. So the four birds trying to take the nut from the baby. These 4 birds represent BRD4, indicating the characteristic BRD4 NUT-M1 gene fusion, which is the most common genetic alteration in nut carcinoma. Now, despite the birds, the baby retains the nut. That goes to say that the baby is smart. The baby is smart and the baby has high IQ. So that is signifying that INI-1 is retained. So the smartness of the baby, that is SMARC B1, and the high IQ, that is INI-1, is retained in nut carcinoma. And although INI-1 is not required for the diagnosis, its retention helps to exclude SMARC B1 deficient tumors. Now the baby's mood here is shown as happy, but we know babies, one moment they are smiling and the other moment they start crying. So this abrupt moodiness of the babies will help us remember the microscopic hallmark of abrupt keratinization. So here you can see that here there are blue cells. These are undifferentiated cells, and here these pink cells are the squamous cells. So there is this abrupt keratinization which is happening from the undifferentiated cells to the squamous cells, and we can use IHC of P40 and P63 to highlight these squamous cells. Also, for these undifferentiated cells we can use NUT IHC, and it shows as nuclear speckled positivity. So the nuclei will show speckled positivity for NUT IHC. So, and also the term midline goes to say that these tumors are more common in the midline structures, like in the head and neck, like in the lungs, etc. So let's revise the nut midline carcinoma. So from the word nut, we will remember baby holding the nut. The nut here is the NUT-M1 gene. Okay. And there are 4 birds. So the 4 birds along with the nut will make the genetic mutation, that is 4 birds BRD4 and NUT-M1 fusion. Now it is a baby, so that goes to show that the age group here is children and young adults. The other thing is that the baby's mood is abrupt. One moment they are crying, the other moment they are laughing. So that is shown on microscopy as abrupt keratinization, and for that we will be using IHC, that is P40 and P63. Also the blue cells here will show us that if we do IHC of nut, there is going to be nuclear staining, speckled appearance.